Hello, and thank you for spending a little bit of time with me today. My name is Charity Bell, and I'm the Director of Training for the Department of Mental Health in the Northeast area. Today, we'd like to talk a little bit about the biology of both addiction and recovery so that we can understand a little bit about the impact of substance abuse on the brain. Why do some people experience addiction and others don't? It's very frustrating to some of us who may live with or treat or in other ways experience people with addictions that we've not ourselves experienced. We have to help our country see that addiction is not a character flaw or a moral failing. It is a disease of the brain. The more we learn about addiction and the more we learn about the brain, the more we realize that it's a complex problem that requires complex responses. Simple sobriety is not the same as recovery. One of the things we hear a lot from people are things like, I used Percocet for an injury, I fell down, I got a few, I took them when I needed to, and then I put them away. I'm not addicted. Why is it that I can have a glass of wine and other people become alcoholics? It can be very hard for us to understand, but one of the things we need to know is that some people are simply more vulnerable to addiction than others. A mixture of biology, experience, and circumstances come together to create kind of a perfect storm, if you will, that can lead to addiction. We know that the vast majority of people who take some sort of alcohol or other substances will not become addicted. The people we need to think about and the people we're now working on treating are those who do. As we look at the brain's journey through addiction, we recognize that some brains are more vulnerable than others. Each individual experiences substances differently, or perhaps they experience them more intensely than others. We do know that the pleasure felt in the first few uses, which is often described as euphoric, fades, and soon enough the person with substance use disorder is using simply to feel okay or to keep from going into withdrawal with the associated pain and other physical symptoms. After substance use stops, we now know that there's not a return to baseline, whereas in previous years we've thought that once a person stopped using and the chemicals left their body, they went back to being the person they were before they started using. We actually know that the brain is damaged by that use and that it takes several months for the brain to resume the production of chemicals to get them back to their baseline, which may or may not have been a comfortable place. When we look at this diagram, we look a little bit at kind of the baseline where someone starts. So someone who's already struggling, perhaps, their baseline, and then they use. And those first few uses are extraordinary. There's a rush of pleasure and a deep remembrance of that pleasure that we're going to talk a little bit more about, with subsequent use providing less pleasure, even at higher amounts. Then someone may move to a point where they're using simply to avoid withdrawal, and those withdrawal symptoms get more intense as time goes on, and they need more to simply return to normal. Then we get to the point where someone detoxes and then a long, slow return to baseline. And we have to understand that that baseline may still be a place where someone is experiencing anxiety, depression, and working on trauma. Substance abuse is a form of trauma to the brain. It blocks or disrupts pathways for affect regulation, impulse control, and other forms of executive functioning. One of the things we need to understand is that those very executive functioning skills that someone with an addiction needs in order to recover are severely limited by their addiction process. In a vulnerable brain, if you use drugs at a high enough dose, frequently enough, and for long enough, you literally change the way the brain works. You change the way the nerve cells communicate in such a way that you develop this compulsive, out of control use, despite knowing that all kinds of terrible things can happen to you, and despite even experiencing many of those things. It's very important for us to understand addiction for what it is, a disease of the brain, as opposed to a moral failing or a character flaw. There are multiple neurotransmitters involved in addiction, and it's useful for us to understand a little bit about a few of them. Misusing substances tricks the brain's reward system, serotonin and dopamine. The things that we enjoy, they're actually the chemicals that are released that make us feel pleasure when engaging in certain activities. Dopamine is about reward and instant gratification. It's a neurotransmitter that sends signals, and there are several distinct pathways, one of which plays a major role in reward motivated behavior. Behavior that we repeat over and over again because it brings us pleasure. It also impacts our memory and affects our learning process. When it's present during an event or experience, we remember it vividly and intensely. However, when it's absent, we don't remember very much. In our day-to-day lives, when our dopamine levels are low and fairly static, we may have a hard time remembering those experiences that happen over and over again, driving to work or what we eat for lunch. It's just not that interesting, but when interesting new things happen, especially those that are pleasurable, that release of dopamine wires our brains a little bit to remember those. The first exposure to drug results in full impact intoxication. Subsequent exposures don't recreate the magnitude of that first exposure. And since that first use of substance results in tremendous dopamine dump, the user remembers it and constantly chases that first high. They're looking to get that feeling again so that they can experience over again that complete loss of inhibition, the loss of anxiety, or whatever else it is the substance creates for the user. Here we can see some comparisons of dopamine release or the perception of pleasure that someone may experience when engaging in certain tasks. If we look at baseline as being the level of comfort and pleasure, the satisfaction that someone may be experiencing in engaging in everyday tasks, we then see that when we add a pleasurable meal, someone will experience a corresponding increase in a dopamine release. Video games are at 175%, and it makes sense when we think about the fact that we often see people who really enjoy video games foregoing meals in order to continue playing. We then look at sex, which was programmed to be pleasurable in order to get us to continue our genetic line at 200%. But then we add some of the substances of abuse, and we see in comparison with cocaine at 450% and methamphetamine at 1,300% of baseline. And we begin to understand why the incredibly intense rush of pleasure that someone may experience from taking one of these substances would be something that they would both remember deeply and seek to recreate over and over again. It's also important for us to remember that other psychosocial needs are being met by addiction and associated behaviors. As people gain relationships within a community of others who are using the same substances, the accomplishment that they may feel from having a need in the morning to use and being able to put together the funds to be able to buy, and then to get and use the associated drugs, there is a feeling of success that comes from repeating that pattern after day. Relief from pain, be that physical pain or emotional pain, and again, the relationships that are a part of the substance use community, especially in the beginning. It becomes clear why addiction is so hard to treat. We have someone whose ongoing use has created a physiological tolerance and dependence. They're no longer using to get high, but merely to avoid withdrawal and feel okay. They have difficulty managing work, friends, and family, and so continue to use the substance to manage uncomfortable situations. And those uncomfortable situations become more uncomfortable as a result of their continued use. It's a vicious circle. Substance use may, in the short run, block feelings of traumatic experiences, and therefore someone may use in order to not to have to deal with the anxiety and pain of their previous traumas. And it becomes a part of a person's identity. It impacts every part of their life and requires a full complement of supports that are equally full to be sustainable. But there is hope. The brain can recover, and we know that over time, people's interest in life and their ability to gain pleasure from things other than substance use can be regained. But it's incredibly important that we support people in understanding the length of time that they may need to endure before they can move back to that place of feeling health and involvement. What can we do? Why is it so important that we here at DMH both understand and be able to apply these principles to our work with persons served on a daily basis? At DMH, we often see people with substance use disorder who are in the very earliest phases of recovery. They're experiencing sobriety with very few other supports in place. They may have been detoxed and moved into one of our facilities, or they may have come out of the hospital and are experiencing their earliest opportunity to choose between continued use and recovery. Both facility and community staff need to be aware of the impact of addiction on the brain and be prepared to support persons in learning about and accessing all the potential supports available to them. We are really working towards providing everyone with motivational interviewing as a tool to begin to work with persons served around understanding what it is about their life that they wish to either build or reclaim from the time before they were using substances. It might help all of us to take a look at and think about this quote. You cannot recover from anxiety by just staying calm. You cannot recover from depression by just being positive. You cannot recover from anorexia by just eating more. If mental illnesses were that simple, we wouldn't be struggling in the first place. You cannot recover from addiction by just staying sober. It's not how it works. That's not recovery. Recovery is hard work. And when people are in early recovery, they may feel worse than ever. Abstinence is just the first step, and setbacks may occur at any time and are triggered by both internal and external factors. DMH staff can support people in recovery by offering tools, information, and holding hope. We are integrating recovery groups and treatments and tools into all of our facets of patient care, and we know that an integrated approach is more likely to be successful, providing supports around trauma and mental health issues simultaneously with substance use treatment. It simply doesn't work for us to treat someone's mental health issues and perhaps think that when they leave the facility, they'll deal with their substance use disorder. Nor does it help us to simply treat a substance use disorder without acknowledging the mental health issues that may have led someone to use or increased that use. Addiction is a brain disease. This is not about moral failing. This is not about bad people who are choosing to continue to use drugs because they lack willpower. We know this as an organization and as individuals, and I'm incredibly grateful to each one of you for the work that you do in supporting persons served in their recovery. I also want to acknowledge that so many of us have family members and friends who are also working through their own recovery, or we hope moving to a place where they choose recovery for themselves. In addition, I am honored and awed by my work every day with colleagues who are in recovery themselves. This is an extraordinary place to be, and we have so much to offer those with substance use disorder, and we look forward to providing them with long-term support and tools. Thank you so much. Take very good care of yourselves.